Domestic violence is a relationship between individuals in which one seeks to assert power and control over the other. The abuser may use several types of abuse in order to do so, and the effects of this trauma can vary person to person. So, neither those who experience domestic violence nor the partners who abuse them fall into any distinct group. They can be of any age, ethnicity, religion, income level, level of education, sex, or gender. There are several categories that victims may fall into and experience within the aftermath of domestic violence, and that includes being affected physically, such as with having bruises, shortness of breath, involuntary shaking, changes within their eating and sleeping patterns, sexual dysfunction, and menstrual cycle or fertility issues in women. But not all abusive relationships involve physical violence. There are a variety of examples that affect one's mental health, such as post-traumatic stress disorder, also known as PTSD, depression, including prolonged sadness, anxiety, alcohol and drug abuse, and suicidal thoughts or attempts. Nevertheless, a victim can be greatly impacted at an emotional or spiritual level. That may be feeling unworthy, discouraged, having the inability to trust, or perhaps the individual may question their spiritual faith and feel doubt. Domestic violence continues to be a major problem in society today, and there are many signs that may be found within an abusive relationship, and fear is the most telling. However, here are a few questions you ought to ask in order to avoid such conflict, and that includes the abuser's behavior and your feelings towards the individual. Just remember, you're not alone.